In this video, I want to introduce you to a really useful but little used feature in SystmOne called action group descriptions, which you can find here. SystmOne have kindly given us an example, but in my experience, very few practices use this or know about it, but it has the potential to be a really powerful tool. So I'm going to show you how it works. And I think we'll use an SGLT2 as an example because I've got some pre-prepared text that we can put in, and I'll explain how it works as we set this up. So it works by action groups. So that means any medication within that action group will appear, and in fact you can see helpfully here the medications it applies to. So clinical indication works if it's always the same indication, but is less useful if the same medication can be used for different things. Patient friendly script text can be very, very useful. So I'm going to paste in here a warning about diabetic ketoacidosis. And the really useful thing about this is that we can get this to print on patient prescriptions. I'll show you how to do that and change the settings for that in a moment. But in terms of just making patients aware of potentially dangerous side effects, it can be really helpful. The last bit is relevant numerics. What this means is that, let me just find the code. So this is the code that most pathology labs use for EGFR, I think, around the country. Slightly sad that I know that. What it means is when you're looking on the repeat screen, it will show you what the latest EGFR is below that repeat for that patient. And you can add on multiple numerics. So statins, you might want the latest non-HDL, I don't know, things like that. And again, it just saves you hunting around in the notes to find that kind of information. So you can do this for lots. I'll OK this one. So if we order it now, it's ordered by patient-friendly text. So you can see that's on this list. Keeps a note of who's done it and when. And then the last bit, if you want patients to be able to see this message, you need to go into your prescription printing settings. You need admin rights for this. And it's this bit here, look, print action group descriptions for each template. Most of the time, there won't be anything there, but the ones you've added will then appear. They'll appear on the counterfoil. Obviously, these days, hardly anyone actually picks up an FP10 or similar from a practice, but pharmacies do hand out the counterfoil, so that information should be on there. While we're here, I'm not going to turn this off, but I would recommend having that one turned off, simply because what this can lead to is patients see that they've got a review date coming up. They phone the practice up and say, oh, I need a medication review. And depending on how you work, you may not necessarily want them to do that. It may be that through your annual review process, you're able to review the medication without a separate appointment for that. And that's about it.